We discussed what to expect kind of in the immediate postoperative period after surgery, but we wanted to spend just a little bit of time talking about what to expect long term because we had a lot of questions about this.
Mhm.
And I think one of the biggest things is that we are looking at a lifelong follow up. And during that lifelong follow up, one of the crucial important things is to know that we're here for you and that our entire staff is here for you. I mean, this is why we have a dietitian and a nurse practitioner and a therapist to kind of make sure that we are giving that structural support long term.
And one of the interesting things is that studies have actually looked at patients that are most successful at keeping off their weight after weight loss surgery. And one of the key ingredients in that is being actively involved in a support group. So we actually have a support group here at our office that meets twice a month. And it's a great place not just to meet people that truly understand what you're going through, but to develop that support system that you may not have at home.
And so we also get a lot of questions like, well, how will this affect me? I think one big thing is people hear about taking a multivitamin regimen. And that's true. You will have to be on a multivitamin regimen. That vitamin regimen is actually the same as if somebody had a sleeve versus a bypass. Now, if you have a duodenal switch, there's a little bit of modifications where more multivitamins are needed. But for the most part, we're talking about one multivitamin in a day and then calcium and vitamin D throughout the day. And we hear a lot of people saying, well, I heard people had a lot of vitamin deficiencies. We rarely see vitamin deficiencies, but the important part is to be compliant, to take those multivitamins, because it can be a problem when you go off of them. Now, if you've gone off of them, we would get you back in line, but another important part of long-term follow-up is that we check your labs on every time you come into clinic, and we make sure that the multivitamins are working well and that regimen's working well for you.
And at the end of the day, the reality is both Dr. Promomo and myself and the rest of our staff here at the clinic are in it for the long haul. We're with you through the journey in its entirety, not just for the surgery itself, because that's what's going to help you be successful long term. But that long-term follow-up is so important because along the way, we are always going to deal with certain things that come up. And just like diabetes and high blood pressure are disease processes where your doctor might have to make tweaks to your medication regimen, etc. It's the same thing with obesity. It's not a one-stop shop. It's not a one-time fix where you have surgery and you don't ever have to think about it again. It's a lifetime, and we're planning to be there with you through it all.
And the other thing is this, is that people will ask, well, I heard that people have problems after surgery, eating or drinking or things not going down well. That's not normal. That shouldn't be happening. And this kind of lifelong follow-up is to look into those things. If there are issues, we want to know about them. But for the vast majority of patients, the expectation is that you're doing well. You're eating and you're drinking well and you're tolerating your diet well and you're not having pain. If any issues like that come up, we absolutely want to know and we want to make sure that we help you with that. But no, these surgeries are not there to make it where people cannot eat or drink or just taking in very, very small amounts. These are surgeries that are really focused on changing that lifestyle.